Hey guys, welcome to Thrive Bites Podcast. I'm your host, Dr. Colin Zhu, and thank you so much for listening on. You could have been anywhere in the world and you decided to spend just a few moments of your precious time, and we greatly appreciate it. Here on the podcast, we talk about three things: living a plant-powered lifestyle, enhancing emotional resilience, and creating a thriving mindset. And I interview a range of passionate guests such as physicians, dietitians, coaches, entrepreneurs, and many more. And please join me as I deliver these engaging, informative, and high-valued conversations for you. So what are you waiting for? Come on inside. Hey guys, what's going on? This is Dr. Colin Zhu, and thank you for joining on another episode. For today's episode, I am joined by my lovely guests who's going to be joining with me today. They represent Partners for Global Health. We're going to be talking about my recent trip to Honduras, and you don't want to miss this. Everything you want to learn about international medical relief and their work in the Caribbean and Latin America, and you don't want to miss this. And also, guys, this is the second to last episode of Thrive Bites Podcast, so you don't want to miss this, and I will see you inside. Okay, guys, so welcome to another episode of Thrive Bites Podcast. I'm your host, Dr. Colin Zhu, and thank you so much for being here with us. You could have been anywhere in the world, and you decided to spend your precious moments with us, and we greatly appreciate it. Today, I don't have just one, two, three, but four guests with us today, and my heart is very filled because we had spent a very, very intimate 1 week together with my lovely guests. And I can't wait for them to come on and to share my recent trip to Honduras. For those of you who don't know, I have done medical missions over my span of my career. And why I do them, because it is a great opportunity for me to serve in a different capacity, to be able to serve a community that needs that doesn't have certain healthcare related resources. And it also combines my love of traveling and to be able to see and witness different cultures and different lived experiences. So my recent trip to Honduras is no different. And I am very, very honored to have my guests with me today to talk about and share their expertise and experiences from our trip. And I can't wait for you guys to have them on. So, or at least I have them on and you guys listen on. So without further ado, please welcome my guests, Lisa Garcia, Britta, Dr. Daniel, and Chris Hendel. Hey, everyone.
Hey, Colin.
Hi.
All right, guys. Well, thank you so much for coming on to the episode with us today. I know you guys, most of you guys are on the East Coast. I know Lisa is in Honduras, specifically in the Bay Islands. I want to start off with this question of how did we get to this point? How do we meet each other? And I know from me, I don't know any of you guys before the trip. I have worked with the foundation that led me to you guys. But I don't know anything. I didn't know anything about this wonderful nonprofit. And so let's start off. I believe we're going to direct this to Britta. Britta, how did P4GH get started?
Okay, so really excited to be on, first of all. And P4GH, or Partners for Global Health, long word, we founded it in 2017, but that was a follow-up to many years of mission trips, medical mission trips that were led by our CEO, Allison Swanson, or Allie, we call her. She had been leading these trips and I've been going ever since 2004. But in 2017, we decided that we needed to make a more sustainable impact instead of the things that we had done. And we wanted to make more of a long-term commitment to specific areas in underserved communities, specifically in Central America. We had been to Nicaragua and some other places as well. And we had learned some hard lessons through the years, and we didn't want to do the drop-in, drop-out mission trips that we had done. We didn't want to be Santa Claus. We didn't want to be Christmas showing up once a year. We wanted to have relationships with local people. And so we got our heads together, a few of us, and started P4GH in 2017.
And Britta, what do you do anything else before becoming the COO? Do you have another life?
Yes, I have quite a life, but in my background is physical therapy. So I work at a hospital in a rehab setting in Orlando.
Gotcha.
I have a life before that too, but I don't know how far back we should go.
Okay. Well, I'm going to direct this next question to Lisa. And Lisa, you are actually on the grounds on Honduras. And so my question to you is that how did you get there? Right? I know by plane, and by boat, but why this specific island, needed this kind of need? What makes this island, right? And you let us know the islands that you help out. What makes them special?
Thank you. It is a very special place, and I'm glad that those of you who've been able to visit recognize that, because those of us who are lucky enough to get to live here certainly think that. I retired to the island. My husband and I retired here 7 years ago. I had completed 32 years in public education, 10 years in the classroom, and 20 plus years in administration. My last 7 years as a superintendent of schools. And by chance, I call it a God wink, I met Partners for Global Health one Saturday afternoon, their first trip over to the island of Guanaja. I met them on the ferry coming from Roatan and started talking to them and helped them with a little bit of problem solving and asked if I could volunteer. I said, this sounds like a really good organization and something I need to be involved with. Could you use any help this week? And so I volunteered that first week, and that seems like decades ago, and it was about 3 years ago. So I've been involved ever since. To your question, Dr. Collin, what makes this a really underserved area and an underserved population is, number one, if you just look at a map, it's geographically isolated. We are 40 miles from the coast of Honduras, and we're 17 miles from the tip of a larger island of Roatan, but certainly not to the center of the island where there's medical care. A trip to the coast of Honduras cost about the same as an average week of wages for an average worker. So it's very expensive to get to the coast. The cost of living on the island is higher than other places in Honduras. So we have a bit of a brain drain in that young talent that serves our community with medical services often leave the island because it's more affordable to live on the mainland. They have more access to better paying jobs on the mainland of Honduras than we have on the island. So there's a lot of factors that contribute to this being an underserved area, but certainly the biggest one is just the simple geography of where we're located.
Thank you for that. Britta, I'm going to come back to you. For this year, we went to the island of Guanaja, but before you've done you guys have done a lot of trips to Roatan. Can you highlight, the things that kind of happened over time that contribute for that need of doing more trips?
Okay, so we started out, Allie and I started out going to Roatan to meet with the officials there, and the local health officials, just to find out where the needs were. And we did some trips to Roatan itself, but they then directed us to go to Guanaja. They said they have a greater need. Now, Roatan also has had its problems. They have the hospital burnt down after we had been there. And so Partners for Global Health actually has 4 pillars, and they are engagement, education, exchange in equipment. And the equipment part really has played a huge role for Roatan. We have been able to ship multiple big shipping containers with big and small medical equipment pieces like hospital beds, bedside tables, ultrasound units. We have donated things that were donated to us by a hospital in Charleston. And and some hospitals in Miami as well. So we came together, especially when they had the fire in Roatan of the public hospital. Several organizations came together, and we received wheelchairs from a nonprofit in Georgia. And so we put it all together and were able to ship multiple containers. And we have some more containers coming with more things. And so the officials in Roatan, they have all of this came about, and we furnished a temporary hospital. But after that was furnished, they said, well, actually, Guanaja needs you more. And so we've donated an EKG machine there. We've donated an ultrasound unit to them, and they're able to improve on some of their healthcare. And we partner with the local healthcare professionals there side by side. So we work with the local nurses and doctors. We ask them what they need, and then we try to help them.
Mm-hmm, mm-hmm. I'll open it up to the floor. What does a typical day look like on these medical missions when you're in these remote areas? I can share my experience, but I want someone to go first.
Okay. I'm going to talk about the team a little bit, and then maybe Lisa can jump in about the setup of the clinic, and then you, Colin, can do the medical part. Is that okay?
Sure.
Okay.
I can share with Dan.
Yes. Oh, yeah. So we get up really early. We wake up about 5:30, and we have breakfast at 6. And by 7 o'clock, we are either on trucks or boats on our way to the local clinic, and where we meet people. We have to carry all the supplies, all the medicine that we have packed previously, pre-packed for the pharmacy. So we carry all that on the trucks and the boats. We have to be a little bit of donkeys as well before we get to clinic. And then we go to the local clinic and walk through and try to figure out how we're going to set it up. And Lisa, do you want to take it from there?
Yeah, thanks. So once the team arrives on site, so we have 2 different sites in Guanaja. One we get to by truck, and the other they come by boat. So once we have unloaded all of the equipment and all the supplies and decided where the space everyone's going to set up, they start setting up their equipment. We will easily have between 50 and 80 people waiting when we get there at 6:30 or 7 a.m. in the mornings. And they're quite happy to wait for the services. They're patient and kind and helpful with each other, and help the older members of the community to the front of the line. And but they'll be anxious, and they'll be waiting, and they know now when the group is coming, and they're excited about that. So we start passing them in through the system. So we have a great system that you and Dan can talk about. Right after they go through triage, they wait again to see a provider, and then they come back and see you guys.
All right, Dan, you've been on the bench. We'll get you through.
Thank you so much. I've been waiting. I'm ready. Thank you so much. All right. And so, I love also the process that Britta and Lisa take towards setting everything up. And from a medical standpoint, why I love that is because we get literally a firsthand view of the culture just by going to, whether it be a church, a hospital, or a shelter, and just gaining insight into how the culture is, where they worship, where they practice. So that's even before we get in. And then we get in, we're immersed in that, which I love. But naturally, after they've gone through triage and, of course, done all the wonderful processing that's set up by Britta and Lisa, they see us medical providers in the back end, where we've, of course, allocated certain spaces to be able to serve, treat, diagnose, and heal anyone that comes our way. So, of course, we're definitely spaced out as best as possible. I mean, some places are a little more cramped than others, but hey, we learn how to share. Actually, we love to share because the closer we are, the more we learn about each other. That's actually why it became so cool, Colin. We weren't just roommates, the entire trip. I mean, he was my office mate the first 3 days in very confined spacing. So we definitely got to get up close with our patients and each other. So it was great to continue to serve people, but also use limited space and use what we had just to do our craft and do it well. And so that's what our part entailed. And it was very rewarding to do that.
Yeah. I want you to think of a memorable patient encounter, and I'll come back to you, okay?
I sure will, yes.
Yeah, so on the piggyback of everyone, just to kind of follow everyone through, basically there's a whole system. Everyone gets divvied up into their own corner. Sometimes you don't even have office rooms. You just have to make it up as you go. Sometimes it's partitioned just by a curtain. And so you make what you do, you use what you have, and basically we're just putting tables, chairs together. We bring our own equipment. We use what we have, what we brought from the States or what the locals already have. And we just work with each other in a team and very, very rapidly. And we try our best to be organized and efficient and get as many people through. I think for us, we did 4 clinic days and we were only a small team of 11, both clinical and non-clinical. I think, and correct me if I'm wrong, Britta, we've done about like 560 patients during that week of 4 days. Would you say that's right?
I thought it was more than that, but I can't. And I have to go back on my.
Over 600, if I remember.
You have to count through the cards.
Yeah, something like that. But over 600, I would say.
Over 600. Okay. Well, that's even more impressive. So, there's no fancy EMR that we plug in. A lot of times you're seeing them for the first time. And if you don't go back, at least for us physicians that don't repeat, you don't have follow-up like you have typically. So, and my experiences are patients are very appreciative. They're very humbled, and they are very present and intentional with just listening and following your recommendations. And the goal is to have continual follow-up, like Britta was saying, and not just to kind of helicopter Santa Claus in and just do a one and done and then leave. So, Dr. Dan, I'm going to come back to you. Do you have a memorable patient encounter? I know that Dr. Dan did a lot of pediatric cases, and I did a lot of adult cases. So,
without question, I think one of the most humbling and the most enlightening experiences was getting not only immersed in the culture, but seeing some of the way that the locals live. So, and by that, I mean home births. So I didn't realize how common of a thing that was. And I mean, it just makes sense. I mean, where are you going to get, the weekly or monthly prenatal care? That's not going to be something that's going to be very routine there on the island, And so I didn't realize how common the home birth and pretty much self-birthing was a thing. I mean, with, of course, their local version of the doula providing assistance. But why that was enlightening to me is because you have this woman who just did her best with the limited resources that she had, bringing in a newborn, this is the third child that she'd had of, the different home birthing experiences that she's had. But her resiliency is really honestly what uplifted me and was one of the more heartwarming experiences. Seeing how well adjusted, because I mean, granted in the US, we're very meticulous about prenatal care, about delivery, about C-section, like super meticulous. I mean, sometimes too much so, but hey, safety is always it's always the best priority and it's the best policy. But nonetheless, it's just so impressive to see how well adjusted these kids were, how healthy they were, how healthy this newborn was, even with the limited resources that she had. So to be there and to be able to provide even more care, provide some resources, even some of the baby formula that I brought along as well, to be able to give that some bottles and to be able to provide that assistance. For me, that was probably the most rewarding experience, knowing that I can help. And number two, just her being a boss, showing me that she was able to really do things so well, and her adaptability and resiliency was so impressive to watch.
Awesome. Hey guys, what's going on? This is Dr. Colin Zulik, head of TheChefDoc, and if you guys have been following, we are in the writing phase of Empowered Kitchen cookbook set to be published for the fourth quarter of 2026, and I'm super excited. Over 100 different types of recipes that are plant-forward, plant-based from over 30 co-authors, including myself. Answering this question, how do our food choices affect me, my community, and the planet that we live on? But I want to address your attention to something way more pressing. Since November 1st of this year, SNAP benefits have been halted and stopped for over 40 million Americans. What does that mean? The Supplemental Nutrition Assistance Programs, which gives us dollars for food assistance for children, people with disability, seniors, and families, are going to be halted. These types of benefits are essential, not optional. So you can join us by pre-ordering a copy, and we will match $25 to every pre-order, and it goes to a local food bank. I'll be partnering with Second Harvest Food Bank of Orange County, and also matching and donating my time to be able to feed families that need it the most. SNAP benefits are essential, not optional. Please help us fight food insecurities, and remember to click on the link below and pick up your copy today, and I'll see you guys on the next one. Chris, I'm going to direct this question to you, okay? Can you tell us a little bit about your role with the organization, just like a quick 1-2 lines, and then also, guide us through in terms of the logistics and or challenges before the actual trip and then during the trip, right? Like, just give us a couple of top 3 logistics and challenges that you typically go through, because you've worked so many years there.
Great. Well, thanks a lot. Yeah, I've been with the organizations since Britta and Allie started this. Was brought on as a board member with Partners for Global Health and serve as their treasurer, and really enjoy the work that the board has done up to the point where I wanted to start going myself. So I got the bug when we went to Nicaragua, and have continued on since, and have wanted to help out as much as I can outside of the trips, because that's only just a couple weeks during the year. So what else can I do? Britta does just so much for this organization outside of just her regular job as a physical therapist, that I've offered to help as much as I can. And Britta has, over the years, built this almost to where it's a great playbook of what happens. Because if you think about coordinating anywhere from 11 to 30 people to go on a trip, the airfare needs to be done, the insurance for the individuals, the logistics of getting everybody to the plane and meeting on time, and then coordinating the luggage. We used to bring all our medicine down there, and that's one thing that we've since changed. We buy our medicine so that we're buying as much from the country as we can and supporting the economy, and then have it shipped right to our hotel. In the past, we had put that in suitcases. We'd ask people to buy $100, $300 or 300 bottle or 300 pill bottle of vitamins and give me 10 of those. And then you fill that up in a suitcase. A, that's pretty heavy to lug around, and B, the logistics of getting everyone. So we've got it now to where that's seamline, but the planning for the ferry, if we need to go on a ferry, for the hotel, for the meals, to make sure everybody's got their meal plan set. Working with the local doctors down there, because we are a partner to them. We're not just coming in acting like, oh my goodness, America's here. Wow, we're smarter than you. No, we are at their direction, and we work alongside them as peers and enjoy that. I'm a banker in my daily life, and I've been able to carry some of the items and some of the things that I've learned from Partners for Global Health and the love to that back to my employer, just from the giving of serving. And that's what you find for that week. All that planning that goes in, the giving that happens, it's so rewarding. And then when you get down there, of course, it's the logistics of making sure we're on the right boat at the right time, at the meal at the right time. People are waiting for us, so we've got to herd 11 to 30 people to the boat or boats on the trips. Luckily, we were fortunate to have a smaller team when I got the pleasure of meeting you all, and we were able to get on one boat. With a much larger one, it's much more. We also have the risk. We're concerned about everyone's safety. So everything we do is first in the name of the patient in the clinic, and then second in the safety of our individuals throughout the week. And we've got this down to a nice pattern now, to where we're tweaking it every trip we go and trying to make it better for the next group of folks that get to go.
Mm-hmm, mm-hmm. Awesome. Thank you so much. Lisa, I'm going to direct this question to you since you're on the grounds, is how does the efforts become sustainable? What needs to happen and what has happened over the years, with that work in tandem with the local communities? How do we make sure that creates a continued ripple effect?
Certainly. And I think the answer to that has a couple of different layers and avenues, if you will. It really comes down to the relationships that the organization has built with elected officials, with community leaders. They know the health officials at the national level, at the level of the Bay Islands, which would be our state. They know the officials in Roatan that get things done. They know the officials here in Guanaja, which is a much smaller island. They've really invested in getting to know those individuals and getting to know how to do business in this country. So how do you ship down a container of medical supplies and get it cleared through customs and actually get it inventoried and then moved to the location that it needs to be? And Britta spoke earlier about not wanting to be Santa Claus, and I couldn't say it any better than that. I've witnessed in my 7 years here lots of organizations that come to the island and they're a one and done. It's a very superficial trip. It's called a medical mission, but it's you look healthy, here's a toy, thank you, have a good day, rather than the investment that Partners for Global Health has made in really being true partners with the island and the medical care on the island. The residents of the island know the organization now. They may not know you as a doctor because this might be your first trip, but they know the T-shirt and they know the name tags and they know when I start talking about it. So I have my own list of what I do as helping out as a volunteer a month before the trip starts, 3 weeks, 2 weeks, 1 week, day before, day of, etc. And when they see me on the Key, which is what we call town where the clinic was held, or in Mitch, and I usually am wearing my T-shirt leading up to the clinic, and they stop and ask me on the sidewalk, "Oh, the doctors are coming. The doctors are coming." Yes, the doctors are coming. Yes, they'll be here next Monday. Please be ready. And so the cadence of the visits has been very important in the sustainability, because now the residents recognize it. And it is not even, it's a 1 week visit. The visits with each individual person is made to feel very comprehensive and very caring. It's not a hurry up, although there's 100 people waiting outside and I'm the one out there with crowd control and I'm nervous that there's so many people waiting. But I go back there and the doctors are doing such an amazing job of not just treating the person, but Dr. Dan said healing the person as well. They're listening. This person may have seen 3 different doctors in the past year. So they're really getting a good story about the person's health history. They're educating the person about diet and nutrition and medical care for a long term. So it's really a very in-depth medical experience for the residents of the island when they get to see the doctors. And so they're accustomed to that. And then what happens after the team leaves is presents start coming. So somebody needs a wheelchair and I get a message that, oh, we're shipping a wheelchair down. So I do what it takes to get the wheelchair to that person and take some pictures and send it back to Partners for Global Health. Oh, this lady needs a walker. She can't walk and she's a really large lady. So we have to order a special, very expensive walker, but here it comes. There's a young lady, 10, 11 years old now, that needs some heart care. She needs heart surgery. And Partners for Global Health has helped arrange all that and has helped monitor her health and is willing to get her this heart surgery when she and her family are ready for that. So it's a continuum of care that I don't know that exists in any other realm on the island from any other of the organizations. So that's a big part of it. The other huge part of it that expands exponentially the impact is the work with the local doctors. So the visiting providers, the visiting medical team works side by side, shoulder to shoulder with our local healthcare providers. And they learn things like Dr. Dan told you the story of the home births. They learn things about how the medical care works in Guanaja, but the local doctors learn from the providers that are coming from the States. So they are there taking notes and taking pictures and learning for the very first time how to use an EKG machine and how to use an ultrasound machine that has been donated, which has changed the lives of people. I can tell you 3 stories right now about that EKG machine just from last week. But the doctors are learning. They have a relationship with the team members. They're texting you guys, sending you pictures. Hey, can you help me with this case? So it is truly a continuum of care that is lifting up not just the residents of Guanaja, which is important for the close to 6,000 people that live here with limited medical care, but also the doctors that are here feel this incredible net of support that comes from Partners from Global Health, where they are completely comfortable texting one of you guys and sending you a picture of something or sending you a picture of an x-ray and saying, hey, can you help me with this? Or what do you think? This is complicated. So that has been, that's just been a tremendous impact, the mutual respect that the relationships that the doctors have built based on that mutual respect it's been fascinating to watch over the years as it has evolved.
Thank you so much. I just thought of a question, and I'm going to direct this to Britta, is, Lisa poignantly, and Chris as well, talked about how, certain organizations will just come in as a one-off, or maybe don't come in, they'll come in at like every few years, or maybe not at all. Right. What is the deciding factors in terms of what sets you guys apart in terms of why and then the how of making something sustainable? Right. Like I don't even know what those, that fill in the blank components is, besides just the decision to say, you know what, let's focus on this and let's make it a continual basis. But I'm just curious on how is the organization set itself apart in terms of, what is it that makes you guys to say that, okay, we want to continue this work, right? We don't want it to be a one and done. Can you speak to that?
Yes. So we made all of those mistakes in the beginning. We were a lot of one and done early on. We didn't know better. And we've learned from our mistakes. And we have made relationships with local doctors in Nicaragua as well. And we have been to other islands, other places, and talked to them. And we ask them, what do you need? And a lot of times they say, we are surgeons without hands, meaning they don't have the equipment. They have the knowledge, but they don't have the equipment. And so we started talking, and I know Allie has been really strong in Charleston in trying to get the local community to donate equipment. But the big thing, I think, is the relationship with the local providers. And when we can have that and we can ask them, we have a dentist that we've been working with, Andrea. She was on this trip. You probably saw her in and out, but we've made connections with them. And we say, hey, what is it that you need? And they tell us instead of us just dumping things on them. And the same with the medicine. We don't just bring down stuff that we think that they need. We ask them, okay, what type of medicine is it that you prescribe? What can they continue taking for their blood pressure? Maybe this medicine doesn't exist in Honduras for different diagnoses. And the same with the physical therapy that I do. How can I help them long term? I can't come down and do a knee replacement because there's not a hospital on this island. They don't have an emergency department to take care of broken bones. But what can I do? Well, we could use some braces. We can use some neomobilizers. We can use knee sleeves just for the arthritis. And let's give them cortisone shots. So I think the biggest thing is the relationship and us wanting to invest our time and our own money and our friends' money and our donors. We have donors that keep coming back because they know who we are and that we are going to go back and we're going to make a difference long term. And we want to give long term, not just once.
Yeah.
Does that answer your question? I'm not sure.
Yeah, no, for sure. Yeah. I mean, I think the through line is really the relationships, all right, the connections that we build and the fortifying, because without the relationships, it's hard to kind of build on top of that, right? And we'll go deeper into that in a second. Dr. Dan, I'm going to direct this question to you. The question is that what kind of impact has medical missions had on your life as a healthcare professional? I know this is not your first one. You've done several in different countries, which makes you very unique. But what kind of impact has it made for you? And then also for those healthcare professionals that are thinking about doing one, right? What can you say to them to say like, hey, try one out, just give it a go?
So I would say it's multifaceted. Thank you for letting me speak to that, just because I think I always approach it from the more I see, the less I know. Reason being just because ideally I always try and inform people there's so much to learn, so much to glean, so much to experience. And I always come from a standpoint that so words and books give you knowledge, but experience gives you wisdom. And I don't get the true wisdom to be able to be as culturally competent as a doctor as I am without gaining the wisdom that I do from the experiences I take on these trips, literally from the patients and from the local doctors and just from the local communities. Because our world and even the U.S., we're all melting pots where there's tons of cultures, tons of people, tons of religions, tons of demographics, tons of walks of life, where in order for me to be the most competent physician I can be, I need exposure. I need the wisdom. And I get that from the experience I get from the communities that I visit. And that's what I think all doctors should embrace when they try and do these missions, or if they're even on the fence when it comes to thinking about doing these. They need to appreciate the fact that you'll become that much better of a doctor just by the experiences you gain from these mission trips. Just also, you get to apply a lot of your knowledge there while you're gaining this experience, but more so, you get to be a healer outside of your normal environment. So it forces you to learn how to adapt. And while you're learning how to adapt, that's enabling you to bring that resilience or that adaptability back to the States and then make you more well-rounded and just make you that much better of a clinician when you return to the States. So I say that's probably the best thing that I gained from these mission trips and why I can't wait to do. That was my 8th. I can't wait to do 80 more. So, I mean, honestly, and I think I had mentioned this before, numerous trips, it's hard to redo them more than once. And I love the continuity that Partners for Global Health has established, so much so that I think I've mentioned it before that I will be a repeater. So I will be at some point be doing it again. Okay. So that
February 28th.
Yeah, that would be definitive. Yeah, I don't know if it'll be February. Definitely soon. I might be an annual fall goer, but we'll see.
Fall.
Yeah,
you guys are maxed out.
But I would say yes. That's pretty much the insight you gain is what I think is the most that a lot of the clinicians or any providers can gain from these.
Yeah. And I would probably add on to that. I mean, I couldn't have said it more eloquently than that, is a lot of my colleagues, and Dr. Dan, you can probably, attest to this as well, is that we face a lot of physician burnout. Physician wellness burnout is very, very common, and it's actually part of the vernacular now. It used to not be that because we didn't have words or vocabulary to actually describe it. And now we have something called moral injury, right? And so what I mean by all that lingo is the healthcare system in our country needs a lot of work. not just to fill in gaps, but maybe a total revamping. And a lot of, at least my experience and a lot of experiences that I hear is, just the incongruity of being able to maximize the quality of patient care as well as maximizing the provider's satisfaction. And so when I go on these medical missions, I am refreshed and renewed in terms of why I came into this space to begin with. And being able to seamlessly and at the same time, not have all the resources that you would normally have, in an American setting, you're still coming out of the experience, to me, comparatively, way more fulfilled. And I had to scratch my head about it in terms of, why that is. And I think a lot of it has to do with simplicity. I think a lot of it has to do with intentionality, and a lot of it has to do with the relationship building and team building that you cultivate and curate in a very short period of time. So that is what I would add to Dr. Dan's response. But in regard with team building, I'm going to direct this question to you, Chris, is how important is teamwork and relationship building with each other, and then also with that local team? And what would you say would be the components of that in order to make it solid and sustainable and perpetual?
I'll answer that last part in one word, and that is intentionality. We're very intentional as an organization about, to your first thing, developing the teamwork. We've gone in and got there on Saturday, had our first clinic on Sunday, and ran hard for 5 days with clinics, and then had a day off. We've found a few things with that, with the organization piece. Is one, we like to split it up in the week now, so we can have some team building. We like to have as you are well aware, we took our first day and spent a whole day putting together some of our medications around the table. And if you're stuck with somebody for 8 hours around the table for just talking about life, you're going to get to know somebody, because there's only so many times you can count to 30 putting the pill bags together for the vitamins. And it just gets to be very meticulous. So you really get to know someone. We saw that with this team that we just had. It was a very cohesive team. It was a nimble team that was working together to get where we needed to go. And I think that was all because we were intentional about wanting to have that first day to not jump into everything. We had doctors from, as you well know, California, Anchorage, Alaska, DC, South Florida. We were all over. So this was unique for us because typically we've been in Charleston, where a lot of people knew each other, and Orlando, where a lot of people know each other. This time we had folks from all over the country, and I think we had one of the tightest teams that I've seen because of the things that Britta put in place for us to kind of have that first day and let's get this done. And then when the providers, to the point about this recurring face-to-face, it is, again, about being intentional. We keep in touch with their medical director, not only on Guanaja, but the one in Roatan. We are very much working with them. We had planned to go back to Roatan this fall, and they asked us they suggested to go to Guanaja because Guanaja needed more work or more help. So we're very nimble as a team and can do that. And that is one way those relationships with the local government, the local medical providers, and the local healthcare government arm has really enabled us to succeed and continue to grow, because they've been very supportive and seen the work that we've done.
Awesome. I'll come back to you in a sec. So we're going to close out. I want to be mindful of everyone's time. My last question is going to be to Britta, but before I go to Britta, my question to, let's just go to Lisa. What would you say would be your last words or takeaways in terms of someone that is either one, wanting to contribute or donate or just, donate for a cause like this, and the why, right? And then for someone that can volunteer, what would you say to them in terms of what they should anticipate?
All right. Well, I think to donate to an organization, as the grown-up adults we are now at this point in our lives, and someone who could afford to choose to make donations in their life. I always try to choose an organization that I have a personal connection with, or that I know is doing very meaningful, very intentional work. And if I were going to do a 30-second spot for donating for Partners for Global Health, that's the key, is that this group is intentional and they are true. They have established themselves as true partners in this community. The community they're already asking me when they're coming back. And so I was just with the story about the EKG machine from the other day. They were asking me then, when are they coming back again? Will they be back in March? And so I'm saying yes, sometime in March, because I'm not going to give them a date yet. So it's always subject to change at this point in the calendar year, and I don't want anyone to be disappointed. But to know that the local community is counting on this group for their medical care is important, and to see how hardworking this team is that they bring and how frugal they are when they travel. Like it's not, it's the first year I'm setting up logistics with Britta. I'm like, really? You sure that like you wouldn't want to stay? And she's like, no, we don't spend money like that. No, we don't spend money on things like that. So it's a very, very intentional decision-making from the leadership of the organization. If you want to come on a trip as a mission team member, I think the way Dan spoke and the way Dr. Collins spoke and Dr. Dan is that it's a life-changing experience when you give back. And you do learn, I was chuckling when you were talking about the simplistic ways of the work here. The doctors were stunned that they didn't even have Wi-Fi in the building. And, it's like Wi-Fi now is like air for most of us. And to start living as a doctor without being able to use your apps and Wi-Fi, and then the MacGyvering that has to take place for equipment to make things work and make it's not the land of plenty. It's the land of let's figure this out and how can we do this with what we have at hand. And I think from my own experience, giving back to this organization has been a tremendous importance in my life to be able to find something meaningful at this phase in my life of retirement to give back to that I believe strongly in. And I think that they're doing phenomenal work, and I'm proud to get to be a tiny part of that. And I think anybody who participated with this organization is going to walk away with that same impression.
Awesome. Thank you very much. Dr. Dan, last words. What is something that you did not anticipate learning about yourself from this trip, and your best recommendation for a fellow colleague to hop on for a trip like this?
So I would say in family medicine, we're generalists, so we learn taking care of literally, they say, cradle to grave, because, you see newborns all the way to the geriatrics. That's what our training does. However, you'll find as though there's a widespread, sometimes some people will lean towards you in general. Many people, including many I went to residency with, lean more towards largely adults, don't even mess with kids. But I think what I constantly get to reinforce for myself is, even without going back to my reference book, even without going to my pediatric pocket manual, when you realize and you're kind of having to force to just get your knowledge base and get that inner, the inner doctor that's not surrounded by all of the crutches that we usually have, when you have to get back to that, you realize how much you're capable of just because you get back to doing what you know how to do. And sometimes you got to remove those crutches to realize, wow, okay, well, I can do this. Wow. You don't need literally a shelf full of books. You don't need, the AI in the corner. No, you can do it. Literally, all you need to do is just trust yourself. And then when the people trust you, makes you feel that much more confident.
Awesome. Thank you so much. Britta, last question. So give us a little bit of timeline in terms of what to anticipate for the next year, and how does one support the mission?
Okay, so the next trip that is planned is February 28th through March 7th, and that will be going to Guanaja as well. Before that, we're trying to find a biomedical engineer to go down with some ultrasound training. And that is sort of in the works. It's not been set up yet because we don't have that person. So we'll put the word out, biomedical. We have some ultrasound units that need some help down there. And we could really use the help in several different locations. But beginning of March is for sure. And that sign up is already on our website. And then we will have the next trip planned for September. And before the end of the year here, we are sending at least 2, maybe 3 shipping containers full of large equipment to Roatan, and that it will then be distributed. A lot of it is going to Guanaja. Some may go to other locations on Roatan or Utila, but in that general area. But it's going first to Roatan, and they're going to help us distribute all of this huge, big equipment. We have a warehouse we have to empty. So we need to ship these containers, huge containers. And I keep saying, but they are huge. If you've ever seen these containers, you have to put everything on a pallet and truck it in. So that goes out of Miami. So how to support us, spread the word, sign up for the March trip. And as soon as we get the September dates, we will have that on the website. We have another way of just signing up as a volunteer. Just get me on the list for the next one, and then we'll contact you. And then donations, financial, we can use all the help we can get, because all of this costs money.
Awesome. Well, thank you, everyone, for all this. This has been a wonderful conversation, very insightful. Thank you for all of you guys for showing up. Even though you guys have your own day-to-day jobs and responsibilities, this is really the true meaning of servitude and charity, and being able to give back in different ways that a lot of times we don't know how to, right? And through the power of connection, through the power of, we don't have resources, we got to figure this out. We figure it out and brainstorm together, and being able to witness the impact and being in a state of gratitude is really the glue that, in my experience, brings all this together. So I wish you guys much success on these continued mission trips. I'll definitely be joining you guys in the future, like Dr. Dan says. And thank you so much for being here on the website. I will put the link in below for those that want to learn more about the website and the organization and where to donate. So, guys, thank you so much, and I'll see you guys on the next episode. Please, everyone, say goodbye to Dr. Dan, Britta, Lisa, and Chris.
Thank you.
Bye, guys.
Bye-bye. Thank you.
Bye.
Hey guys, we hope you enjoy that episode. If you like that, please like, comment, and subscribe. And please follow us on Apple Podcasts, Spotify Podcasts, and anywhere that you listen to your podcasts. And if you felt that this was a benefit for someone else, please let them know. And don't forget to give us a 5-star rating, and we greatly appreciate it. And we'll see you on the next one.